Hello, everyone. I want to share with you some amazing news. So we got recognized as the medical home facility, which is also abbreviated as PCMH. And on this video, I want to share with you and educate you on what being a medical home means. This is a recognition that is really hard to get. It takes about 18 months to transform a practice into a medical home facility. And I am proud to say that our team, and I have one of our team members here, Johanna. How are you?
Very well, thank you. Very excited here.
So Johanna was part of the team with Michelle Santiago in a team from Westchester Medical Center that helped us accomplish this amazing recognition. And it took them 6 months. Normally, like I said before, it takes 18 months for a practice to get to go through the process in transforming and applying to become recognized. And we just received the great news this week that we have obtained our recognition. And I invited Johanna because I know many people don't know what a medical home or PCMH is. And I want Johanna to give you an idea of what it means for us to be a PCMH facility. So Johanna, can you share with us?
Absolutely. So it was a challenging process because PCMH is a group of standards that the NCQA have put together throughout the years. It first started off with the Pediatrician Association back in the 60s, and through the years they've been incorporating, and now they've been aligning it with other quality measures through the system, in the healthcare system. So basically PCMH has 6 different sectors. The main sector, or the first sector, is team-based care, which concentrates on orienting the patient to the practice. So when a patient comes to the practice for the first time, that standard kind of measures how are we telling them about our services? How are they able to contact us? Are we open 24/7? Are we open 365 days? And basically we meet all of our standards there. Then we have the second standard that it's knowing and managing our patient, collecting the data. What medical conditions do they have? Do they have a problem list? What kind of allergies? What kind of medication? Are we reconciling the medication? So for all these things, we have to provide reports, and we have to provide, the different workflows to make sure that our providers are collecting the data at the front end. And I'm sorry, I'm looking at my notes. Connecting the patients to the community resources, that's part of standard 2. If someone comes here and we're referring them to a community resource, what kind of connections do we have? That's another standard that we meet. Then section 3, access and continuity. Again, when we're open, patients can access us this way, but when we're closed, do we have a continuity of care, and how do we deal with that? Do we have an on-call team? Do we have people on staff? That's the other standard that we're measured on.
Being available for the patients at all times.
Absolutely, because they're the patient-centered medical home. We're the medical home, and it's all about the patient care. Then the other standard grades us on care management support. So if someone is diabetic, are you keeping on top of their annual checks, their foot exams, their eye exam? Are you keeping on top of the hypertensives? Are you keeping on top of the asthmatics? And what are we doing about that? What are the continuity care that we're taking care of the patient?
And we've created systems that are going to help our patients, our chronic patients. Like we have a case manager that is managing the patients that we identify as we were going through this process of being the sickest, the chronic patients.
Yes. And that manager, what they do is they get the information through the system, and they have to get on the phone with the patient, and so on and so forth. So all of these procedures we had to put in place, and some of the things we already had in place, but we've developed and changed some of the current procedures that we had. Then we also have the care coordinator and the care transitionals. So when someone comes out of the hospital, how are we transitioning them back into the primary care? How long does it take for us to contact someone after they're discharged from the ER? Are we being notified if they go into the ER? So right now we have different connections that we've had to establish with the hospitals to let us know when one of our patients is at the hospital. We get a notification, and after they get discharged, we're able to contact the patient and get them back into their care. Then there are performance measures and quality improvements. So for that, we have to make sure that all of our key point indicators, all of our reports are in place to make sure that we're keeping up with all of the standards.
Wow. So this is a lot of information, and we wanted to do a video because I think it is easier for people to understand what this is. I mean, you can go online if you want to get more details, but we just want to let you know that, as you can see, our commitment to our mission of really changing healthcare and taking care of our patients, we are extremely serious about. And we wanted to share this amazing news with you. Many of you give us tremendous support, and we thank you for that. And again, thank you so much, Johanna. They did an amazing job. Obviously, I always say you can, working together means winning together. Absolutely. And this is an extremely important rule that we follow here, and it shows the results. So thanks so much for listening. Take care.
Thank you.
Bye.